Good morning. Today is June 1st, 2021. We would like to welcome you to our webinar in reference to self-directed services, staff wages, provider and vendor rates. My name is Rhonda Workman. I am DDA's Director of Federal Programs and Integrity. Natoya Mitchell, DDA's statewide coordinator for self-direction, is joining me today as we share information on a recently published policy pertaining to staff wages, provider and vendor rates, and the exception process. We're also happy that Patricia Sastoque, DDA's Director of Program, will also be assisting us today. And as with all the DDA webinars, we encourage you to ask questions using the right panel. You'll see the tab for questions for which you can enter your questions there. We will be answering questions related to our presentation and also share frequently asked questions on the DDA website. We have also included DDA's regional office staff contact information who can assist you with any individualized person-specific questions or challenges. Next slide, please. Today, we are going to share some background information on how DDA's self-directed services annual budget allocations are determined. We're going to talk about the difference between a staff, employee wage, and provider vendor rates. Natoya is then going to provide an overview of key components in the recent policy and share resources to determine a reasonable wage or rate. Finally, we will show some self-directed service budget sheet examples, reminders about the importance of monitoring your budget, and links to various resources before we answer questions you may have. Next slide, please. First, we're going to talk about the self-directed services annual budget allocation. Next slide, please. This slide here is to hopefully help provide a visual to understand DDA's new process in terms of determining an annual budget allocation that's from the DDA. You see at the top visual our historic process where people self-directing services annually considered their previous year's DDA budget allocation to determine the level of services and frequency to meet their needs for the upcoming year. The funding they allocated for each service was then used to determine the wages to pay staff or rates to pay vendors or providers. Today, in our new process, during the person-centered planning process, people self-directing services work with their coordinator of community services and team members to first identify the level of services and frequency of those services to meet their assessed needs. This information is entered into the LTSS Maryland DDA module system in the detailed service authorization section, which lists the specific services and frequency of services needed and calculates the total cost of those requested services. All the costs for the proposed services are added together and then creates the total DDA budget allocation for which the participant can then create their individualized self-directed service budget sheet and determine staff wages and provider and vendor rates. The use of the LTSS Maryland Person-Centered Plan Detailed Service Authorization for participants enrolled in either the self-directed service delivery model or our traditional service delivery model ensures fair and equitable funding regardless of the service model chosen. Next slide, please. Now we're going to talk about staff wages and vendor and provider rates. Next slide, please. As participants develop their own individualized budget based on that DDA budget allocation we just talked about, they will notice some services require them to list whether they will hire employees or staff, or use a vendor or provider, or even a combination of these options. It is important to understand the difference between hiring a staff or an employee and paying them a wage compared to hiring an independent vendor or provider and paying them a flat rate. This is important for budgeting because the Internal Revenue Service, or the IRS, has different tax requirements for employees and independent contract vendors and providers. Participants must pay taxes for payments they authorize for their employees. Participants do not have to pay taxes on payments they authorize for vendors or providers. Vendors and providers are responsible for handling all tax-related items for themselves or the staff that they employ. A wage is the agreed upon amount that the participant will pay the employees they hire for an hour of work. This hourly wage must fall between the minimum wage for that county and the maximum reasonable and customary wages established by the DDA. In addition to offering a specific hourly wage for employees, participants may also consider offering their employees they hire benefits such as health insurance, training, and even transportation reimbursement. The participant is responsible for paying all employer-related expenses such as taxes and any benefits that they offer. A rate is a fixed price paid or charged for something, especially goods or services. DDA has established reasonable and customary rates for which participants can offer vendors and providers. Vendors and providers are not offered benefits, as they noted already, they are also responsible for paying their own taxes. Next slide, please. This is a chart to help identify responsibilities when participants hire a staff, hire a vendor, or a provider. One difference between a staff or an employee and a vendor, contractor, or a provider is how much control the participant has over their work. When participants hire their own employees, they decide how and when they will do their work. The participant hires, trains, supervises, and can fire the employee if they're not doing a good job. Participants offer to pay employees an hourly wage and are responsible, as we said before, for paying all taxes and also benefits if they choose to offer them. When a participant hires a vendor, the vendor is considered a self-employed contractor. They are paid a rate per hour. Participants can consider rates from minimum wage up to the maximum provider rate. Again, the participant is not responsible for paying the vendor's taxes, and the vendors are not offered any benefits. When a participant hires a provider, the provider is responsible for hiring, training, supervising, and firing staff that they have in their agency. Providers are paid a rate for which they pay for all their staff-related costs, taxes, and benefits. Participants are not responsible for these costs. The participant can offer to pay various rates up to the maximum provider rate. I am now going to turn it over to Natoya to share some information about the recent policy.
Now we will talk about staff wages, provider rates, and exception process. Next slide, please. Thank you. This policy applies to participants receiving DDA-funded supports through the self-directed services delivery model their legal representatives, families, the DDA staff, coordinators of community service, direct support staff, fiscal management services provider, and DDA providers. It sets forth applicable requirements for participants self-directing their services relating to setting an hourly wage for direct support staff they hire directly under their employer authority based on reasonable and customary standards set by the DDA, and rates for paying providers or vendors they hire based on reasonable and customary standards set by the DDA. This reference link will take you directly to the policy. Next slide, please. Some things to note in this policy. Participants using the self-directed services delivery model as the employer of record must set provider vendor rates and, if applicable, staff wages that are within reasonable and customary standards as established by the DDA. For services which the participants has employer authority, in addition to the staff wage, the participant is also responsible for paying from their self-directed budget allocation all required taxes and all staff benefits allocated, such as health benefits, paid time off, staff training, and transportation travel reimbursements they may offer. The participant must stay within their self-directed budget allocation and cannot exceed or authorize payment above their budget, including direct support staff overtime. Next slide, please. Participants may request and DDA may approve an exception to the participant's staff wages beyond the general reasonable and customary range up to established maximum for the exception set forth in the self-directed services, staff reasonable and customary wages. The DDA will pay directly for administrative costs associated with provisions of the CCS and FMS until further notice. The cost of these services do not need to be addressed in the participant's self-directed budget sheet. All employed direct support staff, vendors, and providers must meet the minimum qualification requirements to provide the waiver services for which they are hired or contracted as set forth in the DDA waiver programs applications. Depending on the waiver program service, this may include background checks and certificates and CPA or first aid certification. The fiscal management services provider is responsible for verifying that each direct support staff provider and or vendors must meet the applicable minimum qualifications to provide the waiver program service prior to provision of that service. Based on needs, participants can also require the direct support staff, provider, or vendor complete additional training. When the participants hire their own staff, the participants must ensure their budget can support other employer-related expenses, such as taxes and any other benefits they may offer. For budgeting staff taxes, the standard tax rate is 14% and must be used. Taxes include payment for local taxes, Social Security, Medicare, state unemployment insurance tax, federal unemployment tax, and workers' compensation. Staff wages cannot exceed the established vendor provider rates minus 14% for taxes. The costs associated with benefits are separate and distinct from staff wages and shall be reflected on the self-directed budget sheet. As the employer of record, a person self-directing services has the authority to provide benefits to employers. Some benefits may include health care, paid time off, training, travel reimbursement. For travel reimbursement, DDA will authorize funding up to the maximum of the standard federal mileage rate. All benefits are separate from staff wage and shall be reflected on the self-directed budget sheet. Next slide, please. Now let's talk about overtime payments. Participants should hire enough direct support staff to meet their needs and minimize the need for staff to work overtime. In the event that your direct support staff works overtime, they are entitled to overtime pay as per applicable for federal, state, or local laws. Prior to authorizing overtime, the participant must ensure they have funding available within their self-directed budget as reflected in the budget statement from the FMS provider to support and pay for all overtime costs. Next slide, please. Now we're going to talk about staff reasonable and customary wages. The table shown here provides information on staff wages, ranges to consider. You can hire staff at your county's established minimum wage and may decide to offer future pay increases or benefits based on staff performance. A higher wage can be used if you live in either Calvert, Charles, Frederick, Montgomery, or Prince George's County. In addition, you can submit a request to exceed the maximum range using the self-directed services staff wage exception form we will discuss in the upcoming slides. In the event that DDA rates are increased for staff cost of living adjustments, referred to as COLA, the SDS staff reasonable and customary wages will be updated prior to the COLA effective date for your consideration of any changes to your staff wages. Next slide, please. Now we're going to talk about vendor and provider reasonable and customary rates. Now this guidance is for vendor and provider payments. The table shown here provides information on provider vendor reasonable and customary wages. Rates are based on the Bureau of Labor Statistics. Wage include employee-related expenses, program support, training, transportation, general and administrative and service adjustments. A higher wage can be used if a person lives in either Calvert, Charles, Frederick, Montgomery, or Prince George's County. For example, the range of payment for behavior assessment is from $680.82 to $1,400.51. As per the note, this amount is limited to one unless otherwise authorized by the DDA. Next slide, please. Now we're going to talk about staff wages exception process. We know that there may be unique circumstances that may warrant a closer look. As such, we have established a staff wage exception request process. Participants can submit a request to DDA to exceed the reasonable and customary standards for staff wages by completing a staff wage exception form and submitting with the self-directed budget. Exceptions are the reasons for the participant's request. The exception form is fillable and is shown here on this slide. Next slide, please. The reasons for the participant to request the exception shall be noted on the form and includes the following checklist options. Maybe a lack of available resources in the workforce, such as a rural area, high cost of living or high cost wage area, intensity of participants' behavior or health supports, may include exceptions such as uncommon hours or schedule. An example of that will be small number of time of day. Another possible exception will be expectations of short duration of employment. Participant has a history of high staff turnover, staff certifications that may be required or needed, staff specialized training, years of experience. You may note the number of years, the longevity with the participants, noting the time frame, or other examples may be considered. I'm now going to turn it back over to Rhonda to share some person-centered planning and self-directed services budget sheet examples.
Thank you, Natoya. So now that we've talked about and shared how the budget is allocated, we've talked about the difference between setting a wage for your employees you hire and determining a rate for a vendor provider. Now we're going to share two examples of services that are noted in the LTSS PCP Detailed Service Authorization section and how to reflect decisions in the self-directed budget sheet based on the policy Natoya just shared. This first example is for community development services 1-to-1 staff ratio, which was put into person-centered plan based on an assessed need for a person. Let's say they live in Anne Arundel County. As shown on this screen here, this is just focusing in on that specific details in the detailed service authorization for this service. And we see that there are units noted within each month. These are 15-minute unit increments, and then an annual service cost of $67,849.20. The participant, having this in their detailed service authorization section of their PCP, then needs to decide whether they want to hire their own employees, hire a vendor or a provider, or hire a combination of these options. Next slide, please. These are screenshots from the staff reasonable and customary wage options and the provider vendor reasonable customary wage options, the links that Natoya shared with you previously. When deciding what wage to hire employees or rate to pay a vendor or provider, participants can refer to the reasonable and customary ranges on the DDA website and linked into the policy. We see that the staff or the employee wage range in the top chart is $15 to $18 unless the participant wants to submit an exception request to offer up to $48.52 per hour. The vendor rate noted in the chart at the bottom is $34.53 to $56.42 per hour. So based on that consideration, the participant then decides who they want to hire and the rates they want to use. Next slide, please. For this example, we have a screenshot of the self-directed budget sheet for which the participant fills out. And in this example, we see that the participant has decided to hire their own staff. When the wage to pay the employee has been determined, in this example, $18 per hour, as noted by the blue arrow at the top, the rate can be entered into the self-directed budget spreadsheet, which will automatically calculate the budget total for each line item that's entered. We also see that they are also offering to reimburse for mileage and have estimated 137 miles per year, paying 56 cents per mile, noted with the second arrow. You also see that the required 14% for taxes is also noted. You may recall Natoya mentioned that, which is outlined in the policy. The budget sheet will also contain the total annual cost for all services that are put in the budget sheet to track and help the participant to make sure not to overspend. Next slide, please. So keeping that in mind, when we think about the community development services noted in the PCP detailed service authorization, it noted that the DDA self-directed budget allocation of $67,849.20. If we subtract the cost that is reflected in the self-directed budget sheet we just talked about, based on that participant deciding to hire their own staff, their own employee, paying them $18 an hour and offering mileage reimbursement, that total cost was $27,587.44. If we minus that, that leaves a balance of $40,261.76. This balance of these remaining funds are available to the participant to use. Some may consider it as a safety net for any new needs or changes in decisions that they may make related to their staffing for CDS or other services. For example, they may decide on offering future staff raises based on the performance of their employees. They can also use any cost savings for the individual and family-directed goods and services. DDA previously issued a memo related to accessing those services on not only annual plans, but also on initial. In addition, if the funds are not used, they may be available and help another person on the waiting list. So what we're trying to communicate here is based on your DDA budget allocation of that $67,000, when you subtract the cost associated with your wages, your rates, benefits, and such, at times there may be a balance or a savings. And that savings can be looked at as a safety net for you for future needs and may also be available in the future to help other people who are on the waiting list waiting for services. Next slide, please. So here's our second example that we wanted to share today. And in this example, we're looking at nursing support services. And you can see, similar to the community development services, units have been entered for every month of the year. These are also 15-minute increments. The total annual service cost based on the entry of this information for this assessed need is $7,841.60. Now again, the participant can decide whether they want to hire their own employee or hire a vendor or a provider. Next slide, please. Similar to the CDS services, on this screen, we have copied in the staff reasonable and customary wage option for nursing support services. In it, we see that the staff range is from $42 to $60, unless the participant wants to submit an exception request to offer up to $64.84, or if they live in Calvert, Charles, Frederick, Montgomery, or Prince George's County, they could offer up to $69.56. The vendor provider standard rate, noted on the chart at the bottom, is from $54.84 to $75.40 per hour. And for Charles, Calvert, Frederick, Montgomery, and Prince George's County, we see that the minimum is $58.71 and the maximum is $80.88. Next slide, please. So here's a screenshot of nursing support services reflected in the self-directed budget sheet. In this example, we see that the participant has decided to hire a vendor at the maximum rate of $74.40 per hour. The information is entered here and will automatically calculate. Next slide, please. And so when we look at it in terms of the DDA self-directed budget allocation of $7,841.60, and we subtract the self-directed budget sheet cost estimated at $7,841.60, this results in using all the DDA allocated budget, and there's a balance of zero. Natoya is now going to share some reminders about budget monitoring and then resources before we open up for questions.
Monthly statements are provided to the participant and their legal guardians or designated representative by the fiscal management services provider. Statements are auto-generated by the FMS. The report is a running tally from the beginning of the plan year of debits and credits if applicable, listing expenses such as payroll, benefits, mileage, vendor payments, and other items. This is for participant and teams to better understand the payment which are processed and billed to the participants' accounts, and to ensure the participants do not exceed the authorized budget. Next slide, please. Now we talk about resources. Recently, the DDA has updated self-directed guidance and tools, which have been posted on the DDA's website. To access and view information related to self-directed services from the DDA's homepage, you can click on the Self-Directed Services link from the left navigation panel under Services We Provide. This will bring you to the DDA Self-Directed Services dedicated page that includes an overview of self-direction, FAQs, popular links, resources, and information. Resource and information list includes link to the self-directed services and guidance forms and webinars. Next slide, please. This slide includes link to the policy, reasonable and customary wage and rates, and the staff wage exception form. There are other resources that are available here as well, such as the DDA Self-Directed Services Staff Wage Exception Form and the Provider Vendor Reasonable and Customary Rates. Next, thank you. So this slide includes links to the DDA's Self-Directed Services Handbook for people interested in the service delivery model. It also includes a link to the current DDA's FAQs, and we will add new questions from today's webinar to this document. Next slide, please. This slide includes contact information for our self-directed services lead staff and myself. Now we will open up for questions.
Thank you, Natoya. So we have see a lot of questions related to the handouts and having difficulty downloading those. So we will see if we can reload them. But after the webinar, we will also send out the handout to all participants so that you can have that information. So I'm just going to go through the questions to look at some of the information. We may not have answers to all your questions today, but we will follow up with the frequently asked questions. The first question talks about where can we find the reasonable and customary rates, employees, vendors, and providers? Natoya, you want to share the answer to that one?
Sure. So on the DDA's homepage, there is an option where it says Self-Directed Services Guidance and Tools. And from that page, you can select Services Will We Provide. And then that's going to bring you to DDA's Self-Directed Services dedicated page. And on that page, you'll see exactly the request that you're asking for, which is on this particular policy for self-directed services and guidance forms and webinars.
Thank you so much, Natoya. There's a question that's asking, does DDA have limitations for payment of paid time off / holidays for part-time staff? And that's a really good question. As per the federally approved waiver application, it states that benefits should be reasonable and customary. The DDA will be seeking input from stakeholders related to reasonable and customary benefits for part-time and full-time staff. So we're going to have a stakeholder process so that we can gather some input before formalizing those reasonable and customary standards. The next question is, can you please talk about the difficulty of care, reduced taxes for family members who work as staff? Natoya, do you have any thoughts on this question?
Yeah, sure. So some of the difficulties of care that we've heard about is pertaining to some of those exceptions that we will consider. And I'm just going back to the notation just to highlight some of those points since we shared a lot of information during our presentation today. And so some of what you might want to consider for the exception process will be if you had experiences with high staff turnover. You might want to also talk about a staff person that you may have that have worked with the participant for a significant amount of time. And again, these are just some examples for which you can receive an exception for to consider paying over the reasonable and customary wage. So I hope I answered the question, but again, if there's anything else further, we will look at those additional questions and provide answers to.
Yep. Thank you, Natoya. And some of this question talks about reduced taxes. And so taxes will all be provided and coordinated through the Fiscal Management Service Agency, who can then provide additional assistance and guidance to tax-related questions.
Sure, and if I can just add just to that, and that's a really good point, Rhonda, as well. It's important just to, if you do have a family member that's working as staff, and if you know that information earlier on, just share it as well with the onboarding process for the FMS, so the FMS can ensure that they are providing you with all appropriate documentation for consideration of the reduction of any staff, or just making sure that the family member that's working as staff are following all guidelines, because we don't want anyone to, have any hiccups throughout the process.
Great. Thank you, Natoya. The next question is a contractual dehabilitation listed as state-only funds, as we were told in the last webinar on January 26, 2021? So a couple things related to self-direction. Initially, we were having a challenge with dehabilitation being reflected as a self-directed service in the PCP detailed service authorization section. That has been corrected for some time, and therefore dehabilitation is an option under self-direction and can be selected in the PCP detailed service authorization section. In terms of listing the actual provider, a provider would not be listed in the LTSS PCP because the services will be billed and paid for from the fiscal management service provider. So the name of the person would be, or the name of the agency would be coordinated with the FMS, and the services will not be billed through LTSS. The next question is, does day have to be 1 or 1, or can it be the regular ratio that providers has for what's adequate for the individual, such as a 1 to 9? And that's a great question. And I think that that's a conversation with the team and the participant in terms of the services and supports that they would like to be provided, such as some individuals may want to receive supports in small group or large group, and others may want to receive services or have an assessed need for a 1-to-1 or a 2-to-1 staff participant ratio. The next question is a bit long, so let me see if I can read through it. If staff A is maxed out at the max wage rate, can they still use the savings from another staff B who gets paid less, so leaving more savings to go to staff A for mileage? So this is a really good question. The staff wages, the employee wages, cannot exceed the maximum wage amount that we have reflected in the chart. Cost savings may be able to be used for other benefits, but you could not exceed the staff wages that are established in the policy beyond what the exceptions process is noted. Couple comments about links not working. Number of miles, is this by week, not the year, correct? I believe it is noted within the self-directed budget sheet is how you would reflect the mileage, and we have the specific units that would, or measure would be noted in there. Can we make the handouts available? Again, sorry for that. We'll make sure that those are available. Question about, can the unused funding shown on slide 25 be carried over into the next fiscal year? The answer to this question is no. What we've shown when we first started talking about the DDA budget allocation process, every year the participant, with the support of their team, will engage in person-centered planning to identify their current assessed needs and services and supports that they need over the next year. From that, That information, as we noted, will be entered into the LTSS Detailed Service Authorization section, which then will create funding associated with each service that will total up to be the DDA self-directed budget allocation. Therefore, every year, the participants' needs are considered first, and then the funding will be associated with that. Funding will not carry over into the next fiscal year. And the handouts have been re-uploaded, so you have the opportunity now to click on that and download those handouts. Next question is, would we need to complete an exception form for individuals in those specific counties, Calvert, Montgomery, etc., or is this something allocated in the detailed service authorization allocation? So that's a great question. And so the answer to that question is first, no, you do not need to complete the exception form in order for the different cost and rates to be reflected into the detailed service authorization allocation. The system, the LTSS system, in the detailed service authorization section includes all the services and associated rates to include a different rate for those counties that we noted, Frederick, Montgomery, Calvert, Charles, and Prince George's County. So you do not need to complete the exception form process in order for those funding to be reflected into the DDA budget allocation. The next question is, are nursing supports reported? What if the family participant does not want nursing supports? Natoya, you want to respond to that one?
Sure. So all of the services that are offered within the waiver and indicated on the PCP are based upon the person's assessed need. So if nursing supports is a service that the person needs, then that's a service that should be provided to the individual.
Thank you.
You're welcome.
There's a statement that MedSource does not provide monthly statements, which makes it difficult to make accurate accounts of the budget, and many times the ARC statements are incorrect. Thank you for sharing that information. We're happy to look further into that. But we always want to remind and encourage everyone that if you have concerns or challenges, please reach out to our regional offices. We're here to help you to look further into the information, and having specific details such as the specific participant or month related to these statements and such will make it easier for us to follow up and seek resolution to any challenges you may be experiencing. The next one says, so staff can do overtime as long as they are within the allocated budget amount from the DSA. Would this require a budget mod of some sort or any request forms to be completed? Natoya, do you want to answer this question?
Yeah, sure. No additional forms are needed, but what's very significant and very, very, very imperative is that if a person is potentially going to reach where their budget's going to be over, it's very important to note in advance that additional requests for funding and additional requests for services so that we can ensure that the person's budget is not being exceeded in any way. And that includes paying staff overtime.
Right, so the thing to keep in mind is that a person-centered plan is based on assessed needs, so those hours are there. And the hours that are associated and reflected that creates that DDA budget allocation are based on straight hours. They're not based on overtime hours. And as Natoya shared and then reflected in the policy and other recent guidance, it is important to make sure you identify enough staff, vendors, or providers to meet your needs, because the funding associated with those services units are not loaded with overtime. So if you're having a staff work extra time, they're getting paid in time and a half, whereas your budget really only supports being paid straight time. So it's really important to monitor your budget to make sure you have the funds in there to support it. So if you do have some cost savings, it may be able to address those overtime hours. And so what we're really looking for participants with the support of their team as the employer of record need to make sure that they're managing and maintaining and staying within their budget. Next question. Why were the maximum rates for staff employees decreased drastically in the new policy? The old reasonable and customary rates provided support brokers could be paid a maximum rate of $65, with non-agency supports typically being proved at a rate of $50. But now the maximum rate is only $30. How are we supposed to retain staff when we are drastically decreasing this rate? It's a really good question. And so what's reflected in the policy and also reflected in the reasonable and customary options, it reflects the ability to submit that request exception up to the maximum, which is the $65. That's the maximum based on the rates that we have that are available based on establishing the rates. Question, can we move back to the slide with the self-directed lead staff? Patricia, can you go back, I think, one slide? Thank you. Yeah, so these are our self-directed lead staff in each of our region. They do amazing work and are very responsive to questions, concerns that you may have and help to facilitate resolution, in addition to Natoya as our statewide coordinator of self-directed services. Next question. Who notifies vendors when an employee's plan and budget is approved and the start date? And how is a vendor kept abreast of what is left in the budget as the year goes by? It's a great question. So when a plan and budget is approved, the DDA informs the participant and also sends the approved plan and budget to the fiscal management service provider the participant has chosen. The participant is the employer record, can then work with their staff, their vendors and providers to provide updates, to coordinate those start dates and times based on their preferences and as approved within their plan. In terms of how is a vendor kept abreast of what is left in the budget as the year goes by, that is the participant's responsibility to ensure that they are overseeing, managing, and monitoring their budget and have the funds available for their employees, the vendors, and providers that they hire. Next question. Can you explain what the Fiscal Management Services Group does? What a great question. Natoya, can you talk a bit about what fiscal management services are and their scope and our current processes?
Yep, sure, that's fine. So with the FMS, they're responsible for managing the DDA approved budget for everyone who is self-directing. And so part of what they do in terms of their scope is that they assist with the onboarding process for all staff that are considered, whether it's an employee that's working on behalf of the participants, whether it's provider or vendor that's working on behalf of the participant. And some of that information that they may request includes essential information such as the name of the staff person's address. They also have a process that they assist with background checks. And then if you do have someone that's working as your staff person that is a family member, it's important to share that information, as well as if that family member resides with the participant as well. And all of that is done just to ensure that the FMS can properly do their reduction for any employee-related expenses, such as your taxes. Your taxes might be your federal taxes, your unemployment taxes, your local taxes, Social Security, so on and so forth. And the FMS is also responsible for providing statements to the participant. So again, if you have any questions regarding a statement that you may receive, or if you don't receive it, you can always, reach out to the FMS. So that's just some of the information regarding the scope for our fiscal management service providers.
Thank you, Natoya. The next question really is linked to that, so I'm just going to ask it and so you can reinforce it. It says, in the budget monitoring process, who creates the monthly statements?
Sure. So the FMS creates the monthly statement, and again, it's based upon DDA's approved budget. And you do have the option where you can submit modifications. So again, it's very important as the participants as self-directing to ensure that you are monitoring the staff that are working as well as their hours and any vendors that you may have to pay for rendering specific services to you.
Thank you, Natoya. And we encourage you, participants and with your support team, to make sure that you are submitting your employees' timesheets and vendor and provider invoices timely, because delays in that will cause a delay in reflecting those true costs in your monthly statements. It's kind of like balancing a checkbook. You've got to have the information in the system in order to reduce that. So it's really important to make sure that you are submitting and signing off on services that were actually rendered. And in addition, as you're considering any changes, maybe you need to do some overtime and you're looking at that monthly statement, keep in mind services or timesheets and invoices that may not have been submitted yet that maybe you're still reviewing. The next question is, when a vendor is submitting a detailed service authorization tool, should a rate be assigned by vendor or is it chosen by the participant at the PCP meeting? That's a great question. So the Detailed Service Authorization Tool, or DSAT as we sometimes refer to it, is a tool to support communication with providers, with the participant and the coordinator of community services in terms of the services that they're proposing and maybe some units related to it. It is not required under the self-directed model, but it is an option that the participant could request from the provider. And in terms of the rate is chosen by the participant. So the participant would work with the vendor and worked with the providers to seek those services and to negotiate those rates based on the participant's choice, budget, and those other considerations they have. Okay. Let me just look at some other questions. Budget was submitted in one of the regional offices and required review for the self-directed budget sheet. And asking for an update related to that. So please, again, reach out to your self-directed leads that are noted here. The regional directors are also available if you need some additional assistance with that. We are, as notice was provided in December, reviewing all self-directed person-centered plans and budgets. Based on our current tracking, we are on track to complete those by the end of the month. So if you have questions or concern and something has been delayed, please reach out to the regional office and they can provide an update. Next one says, thank you for this helpful information. In regards to monthly service reports, please explain which date the reports are based on. The date on the PCP, which may be at any time, or the traditional fiscal year, July to June. We have a lot of trouble figuring out how much sick leave is left or how many hours are left in each category. So that's a really great question. And I would suggest that you follow up with your fiscal management service provider who's providing those monthly statement reports that can provide additional details related to the format and the information within each report. We do have 2 fiscal management agencies currently and may have different reports and formats. So those are great questions to talk directly with your fiscal management service provider who is then providing those statements to you. The next question is, can you clarify how to calculate a budget line item when doing a revised plan? Natoya, you want to start with that one?
Sure, I'll start. All right, so the question is what to do when you're trying to make a revision. So just keep in mind some of the revisions that you may make to a particular service line might be to increase your hours or you might want to decrease your hours because you might determine that you need some additional supports in another line item. And those line items are often referred to as the different waiver service that you might be receiving.
Great, thank you. And when you do that revised plan, a couple things to note. That revised plan, because you may increase or decrease the service, it will change the DDA budget allocation. It'll change the overall total cost for that plan. Now, most plans are going to reflect a 12-month period of time. And so when you do the revised self-directed budget sheet, as we've noted in the self-directed budget sheet instructions on the DDA website and those self-directed forms Natoya mentioned, you're going to complete the budget sheet and reflect the full year and that new amount that's based on that revised PCP. We have found that there have been a few PCPs that are being created that are not reflecting a full year of services. And in that case, your coordinator of community services and regional office can assist you, and your self-directed budget sheet should reflect the months and the weeks associated with the PCP, because that's the funding that's been associated. So if you're having challenges with that, please reach out to your regional office and they can provide assistance in that.
And just to add to that point, what Rhonda just made, just also to ensure that you have the most recent account from your fiscal management services provider as well, because that's going to also assist you in your revisions in determining how many hours or how much money you have remaining in whatever line item that you're seeking to make the revision for.
Yep. Next question, will the unallocated detailed service authorization LTSS funding be shown on the individual's FMS budget sheet as unallocated funds? If not, what will the process be to access those funds? That's a great question. So I think at this point, if there's an additional need and to access those funds, the self-directed budget sheet would need to be revised and shared with the regional office so that that authorization can be processed. So the FMS has the current authorization and budget sheet for which then they can utilize based on the participants' choices to reflect services and supports. Next question, if the person has an unpaid support broker, how does that get into the detailed service authorization to show that they have the serve and don't want it to pay? Let me see. And show as an unallocated funds. If not, what will the process be? Sorry, I mixed two of them. Let me read the questions again. If the person has an unpaid support broker, how does that get into the detailed service authorization to show that they have the serve and don't want it paid for under the budget? So that's a great question. In the DDA person-centered plan, for every outcome, there's an opportunity to show unpaid or other resources that are available to support that outcome and goals. So in this situation, the support broker, if would not need to be reflected if the choice is to not pay or receive those funding, then they would not be noted in the detailed service authorization section, but would be listed in the outcome section as an additional support. Next question, if the self-directed participant selects a provider and the provider cannot be listed in LTSS, is that provider able to authorize services in the LTSS system? Does the provider see the PCP on LTSS? It's a great question. Under the self-directed service delivery model, we do not list the specific DDA provider if one is selected. That's because the payment process is all through the fiscal management service provider. So therefore, the provider will not be able to see the PCP in the provider portal. So the information, the service request and referral is all done outside as per the self-directed service delivery model. So that brings us to just about time in terms of our webinar for today. We appreciate you joining us today and hope that this information providing some background and overview about the self-directed budget allocation process, talking about the differences between employee wages and provider and vendor rates. Natoya sharing information about our policy and the exception process to exceed those employee wages. We've shared some information, some examples about how to utilize the DDA person-centered plan, detailed service authorization in consideration of options for employees and provider and vendors to then create your self-directed budget sheet. And then again, the importance of budget monitoring. We will look at the remaining questions based on the frequently asked ones. We'll add them to our document and hope you have a great rest of your day. Thank you for joining us.